I am Justin Medals Daniel from BSN 212G, and today I am going to perform the Leopold's maneuver return demonstration. The Leopold's maneuver is a systematic palpation of the abdomen for assessing the fetal position and presentation. So prior to the performing of the procedure, I have already performed hand washing. This is to prevent the spread of microorganisms, and of course, prepare the necessary equipments, which are the pillow, rolled towel, and a stethoscope. So now I have to explain the procedure to my patient to gain my patient's cooperation. Good morning, ma'am. I am Jasmine Sedanya, your student nurse today. Kindly state your name and birthday, please. Okay, ma'am. So today we will be doing the Leopold's maneuver, which means that I have to expose your belly, and I am going to palpate and feel your baby, and then I will determine the position of your baby inside your uterus. Will that be alright, ma'am? Okay. So now I have to let my patient empty her bladder because a distended bladder may slightly deviate the uterus. So ma'am, I encourage you to please empty your bladder so that you will get you won't get uncomfortable during the procedure. So now that my patient have already emptied her bladder, I am now going to position the patient in a supine with one pillow under her head and knees slightly flexed. So this is to facilitate accurate assessment and providing comfort. So now I have to place a rolled towel under her right hip to shift the uterus away from the large vessels and thus prevent supine hypotensive syndrome. Okay. So I am now going to expose her abdomen. So ma'am, I am now going to expose your belly. Okay. So since I am right-handed, I am currently standing at my patient's right side to easily grasp the symphysis pubis to be done on the third maneuver. So I'm now going to proceed with the first maneuver, which is the fundal grip. So first is to palpate the urine fundus to determine what part of the fetus lies in the upper part of the uterus. So it may be fetal heel, which feels hard and round and freely movable and ballotable. And while the bridge feels softer and nodular. Now for the second maneuver, which is the umbilical grip, I have to palpate in the downward direction and the sides of the abdomen by applying gentle but deep pressure to determine the position of the fetal extremities, fetal back, and the anterior shoulder. So we will know if it is fetal back if there is a long continuous structure felt, while it is extremities if you feel nodular reflecting the portion of the fetal extremities. Now for the third maneuver, which is the pollex grip, place one hand over the symphysis pubis and grasp the lower uterine segment between the thumb and fingers to feel the representing part. So for the last maneuver, which is the pelvic grip, to do this, face the client's feet to confirm the findings of the third maneuver and determine the flexion of the vertex of the pelvis. Now that we are done with the four maneuvers, we have to locate again the back of the fetus and place the stethoscope and listen to the fetal heart tone for 1 full minute. Okay, so 1 minute is over. Now we have to note the location, the rate, the character of the fetal heart tone. So presentation, the fetal heart tone can be heard on either left or right lower quadrant or the abdomen, while if breech, fetal heart tone can be heard above the left of the level of the umbilicus, either left or right. So, mom, we are now done with the procedure. I am now going to cover you. So, lastly, document the observation made to promote database for the future.